There will be a satellite symposium talk where I'll be discussing updates in melanoma immunotherapy in the year 2016, where we'll review developments from the AACR meeting, from the ASCO meeting, and even discuss some of the new data that are being presented at this meeting here. And we'll simply talk about what the newest developments are and what I think are the important things that have been presented over the last 12 months. Well, the developments are mostly the evolutionary updates to existing trials, the fact that the mature survival data from the Ipilimumab, Nivolumab versus Ipilimumab trial now shows 2-year survivals of over 60%, that there appears to be a very nice plateau that's beginning above 50%. We'll talk about the longest survival data that we know, which are from the original phase 1 Nivolumab melanoma study of 107 patients, where at year 2, year 3, and year 4, you have about a 35% survival rate, suggesting with Nivolumab, as with Ipilimumab, that there's a plateau. We'll discuss the fact that when patients get pembrolizumab, the other PD-1 antibody, and have a complete response, virtually all of them stay in remission with 2 to 3 years of follow-up, again suggesting that many of them are probably cured. And finally, we'll discuss one of the more interesting abstracts from ASCO, which was presented by a young fellow from Australia named Menzies, which says that patients with autoimmune diseases, even significant ones, who receive checkpoint inhibition can tolerate it fairly well without a life-threatening or severe flare of their disease in almost all cases. So those are some of the updates to the treatment of melanoma with immunotherapy in the year 2016.